Hello and a very warm welcome to India Development Debate. I'm Vikram here in the Mumbai studios of ET Now. We have a packed show ahead. But top of mind, like most evenings these days, is the coronavirus and its impact on the economy around the world. The Indian economy, of course, and businesses are suffering. We are taking up the pharma industry and the impact that it is facing. India's pharma industry is reeling. It's reeling under the virus stress. The government has now formed an 8-member expert panel. And this panel is going to suggest the banning of exports of 12 essential drugs, drugs that include antibiotics, vitamins, as well as hormones. Of course, India imports nearly 20 to 25% of raw materials of drugs from the Hubei province, which is the epicenter of the COVID-19 outbreak. The ban is now to ensure that India does not face a shortage of supply in the market. And let's discuss this now. Sudarshan Jain, Secretary General of the Indian Pharmaceutical Alliance, is joining us. Great to have you with us, Mr. Jain, but certainly not the best of times. If you can help us understand the severity of the problem as it stands, because it has been steadily getting worse as far as the impact of coronavirus is concerned. There are conflicting reports coming in as well, whether we are peaking out or not. There has been a change of numbers from China's side, all of which makes us wonder, what do you turn to for solid information? Meanwhile, businesses need to hedge their risks. As far as the pharma industry is concerned, now with this 8-member panel that has been formed, which is likely to put a ban on these important export items which might really affect our own pharma industry. How severe is the problem that we have to enforce such an export ban?
Thank you very much, Vikram, for inviting us. I represent the Indian Pharmaceutical Alliance. I will not go by speculation, and it is important for all of us to contain the speculation as far as this area is concerned. India is the pharmacy of the world. We have got import-export commitments, and there is no discussion with us as far as containing the exports is concerned. We have got long-term commitments, and our recommendation has been always that let's not contain the exports, because it takes time to build the exports. We are net foreign exchange earner. As far as the database is concerned, Indian Pharma Alliance companies, which contribute around 60% of the market, have collected the data. And as per our data, we estimate that we have got 2 to 3 months inventory. We are monitoring the situation at China. We are working very closely with the government. So the situation stands as it was 2 days back.
All right, so it hasn't changed much. You're saying that the problem hasn't escalated from the industry point of view. The problem has not escalated. As far as this 8-member panel, which is considering a ban on exports, you are not for it.
And I'm not very sure whether this media report is right as far as the recommendation of 8-member committee is concerned. They are evaluating the data. I don't think at this moment there is any recommendation to stop the exports.
So what kind of impact do you expect on industry? Are you seeing this perhaps as an opportunity where India needs to step up and use this opportunity to ensure that the kind of drugs availability that needs to be made, not just in India but outside, we seem to be capable of, and we can continue and perhaps grow it?
So the way we look at it, there are 2 ways we are looking at this issue. First is the short term, and second is the long term. Short term is we are taking stock of the situation, making sure that the medicines are available both domestically and to meet our commitment for the export market. We have taken stock, and as communicated 2-3 days back, we have got 2 to 3 months inventory as far as API is concerned. So that is short term. In the long term, we have got the capability as far as API manufacturing is concerned. We used to dominate API market in 1990s. So we like to work with the government that how do we revive this industry back and get our dominance. So this is call for action to revive this industry. We will like to see this more as an opportunity to get going, put our integrated efforts and revive API industry where we have got the competence going forward.
From what I understand, India gets around 80 to 85% of its APIs, which is used for making these medical formulations from China. And Indian pharma majors like Lupin, like Sun Pharma, like Dr. Reddy's, they manufacture APIs. But essentially, it is for captive use. So how much are these companies actually suffering because of what is happening in Hubei province, because of the lockdown over there and the escalation of cases? So which is not likely to improve from all likelihood, from all signs right now, it's not likely to improve anytime soon. Yes, you do mention your inventories, but obviously inventories will run out and this is going to become a problem. So for that, perhaps the government is working. So I'm just wondering how much it impacts even 2 months, 3 months later, these very companies that rely on Hubei province for these inputs from China.
So Vikram, like there are other parts of China which also manufacture APIs. So what we are trying to do is that will the production start coming from other parts of the China? Will the logistic improve from other parts of the China? Then there are alternative sources around the world which we are evaluating. And I will request everyone that we should not get into speculation. And the good point is that Indian government and all stakeholders, whether industry, they are working on database to ensure that the medicines are available for our citizens as well as around the world.
But do you reckon, Mr. Jain, that there would be a situation, because as soon as there are shortages, it means a ramp up in prices. And perhaps the government may be mulling its options to ensure that such price rises, especially when it comes to essential medicines, doesn't happen. We are in a precarious situation as far as the economy is concerned. Inflation is actually running up. So this is happening at a time that we can ill afford any kind of price rise, especially when it comes to these medicines that our companies produce. Do you reckon that that could actually happen?
So the price rise is happening, certainly. And we are monitoring also the price rise situation. The important part will be to make sure that no one takes advantage of the speculation and start increasing the price. That is very, very important in this critical situation. So the point which you are making, yes, price increase is taking place because people are taking advantage of the situation. Our recommendation is that we should contain this speculation and work in an integrated way to service our patients.
Are you ensuring that there is a thorough clamp?
Good point is,
yes,
like we have the inventory.
Carry on, sir. Yes. You made the point that there is inventory.
The good point is,
especially in these difficult times, you find cases of hoarding. You find that there is artificial shortages that are created as well. How does the industry plan to deal with that? Because these are essentials that you're talking about, and we can ill afford that either.
So you are right that in these kind of situations, people take advantage of the situation. There is hoarding, there is selective supplies. So government, we have requested the government departments to follow up that we avoid this kind of situation. There is not, people don't take advantage. But having said that, we are also following what are the alternative sources where we can meet the supply. And the issue is primarily with the penicillin G based products. And they are select antibiotics and vitamin products where we are concerned, and we are monitoring those products particularly where our dependence is exclusive on China and there are no alternate suppliers available. It is important that in this kind of situation there may be some price increase, agreed, but the shortage should not be there of the medicine. So first issue is making sure that the products are available, ensuring to whatever extent is possible that the prices is contained, and we are able to meet both countries' requirement and export requirement.
Mr. Jain, what is the worst case scenario that you are preparing yourself for? Because I was speaking to several people who understand this virus so much, so little actually is known about the virus so far that it's a wait and watch mode. But at the same time, since there is so little that is known, you need to be more prepared for the worst case scenario. How is the pharma industry preparing for that?
The very fact that we have got a strong database and we are aware where there is likely shortage can be there, where we are meeting the requirement. And the committee and the government and the industry are meeting on a daily and alternate day basis. It's a very integrated efforts according to me, and this is the best which is government in trying to do. So deal with the situation in a short term, and also work on a plan where we are able to contain likely scenarios in the future.
Mr. Jain, appreciate you joining us.
We need to realize that penicillin G plant.
Yes. No, I mean, these are troubling times.
It's
one can only hope for the best, but one has to be prepared for the worst. And
these
that's
are
what I was
troubling
trying to
times.
get at. Yes.
Absolutely, Vikram. You can rest assured. I have never seen the integrated efforts by all stakeholders. We are alive to the situation. We are taking all necessary actions, and we will keep you updated as and when new developments happen in this space.
We will draw reassurance on those words. Thank you, Mr. Jain, for joining us on this edition of India Development Debate. This is our understanding of the API situation as it stands. The government mulling through an 8-member panel to see whether export bans need to happen on all those APIs that currently make the pharma industry produce the kind of medicines that they do, essentially to make sure that we don't have a shortage in India. Meanwhile, talking about the coronavirus, the China Health Commission has said that the death toll on Sunday has reached the number 1,770. That number increased by 105 compared to the previous day. And the country, China, has seen 2,048 new confirmed cases, which takes the total number of infections to 70,548. That cruise ship, the Diamond Princess, it's the largest cluster of infections outside China. Now, that has seen over 70 new confirmed cases. A delegation of the World Health Organization is also expected to reach the cruise ship today. But let's get a complete lowdown of the latest on the virus and our state of preparedness as well. For that, Mr. Tarik is joining us. He's a spokesperson with the World Health Organization. Mr. Tarik, welcome to the show, and thank you for joining us on this discussion about the coronavirus and where we stand. First up, if you could please address the issue of the conflicting reports that we are getting, sir. On the one hand, we hear the outbreak is peaking out, that the pace of infections and the deaths is slowing down. On the other hand, we have very intense statements coming out from the World Health Organization as well, which says the pandemic is worse than terrorism. So where do we stand on the severity of the COVID-19 outbreak, the potential that it has of causing further casualties?
Well, we think it's still too early to say where this outbreak can go. We have seen in the past, with outbreaks of other diseases, that the epidemiological curve can go up and down, and that the disease may go quiet for a period of time and then come back again. So we really try not to focus on any predictions or giving characteristics of that sort, but rather to work with the countries around the world to increase the level of preparedness and also to try to work on solutions from a scientific and public health side.
Mr. Tarik, I appreciate the fact that you would choose to play this cautiously, but we are walking on very thin ice here, and it's work in progress as far as finding a cure is concerned. But at the very least, can't you at least ratify for us whether or not we are seeing a peaking out of the pandemic at all, like some reports suggest? Because numbers, they're all we have as facts so far, and even those are coming under a shadow of doubt.
Well, again, we should really try to understand the virus better. We don't know really still everything about virus itself, so we don't know how the virus may be behaving in one part of the year or another, or how it may adapt to different temperatures. So it is really important that we get this knowledge and fill those gaps. What is important, instead of saying, giving over reassuring or over worrying messages, is to tell to people that there are things you can do, and please follow the advice from your health authorities. We want people not to go into panic mode, but we don't want to give over reassuring messages either that we may not be able to substantiate with the facts. So it is important for everyone to know that we know about this virus, that it's being transmitted by droplets. droplets to close contacts, that hand hygiene is very important, that behavior that is recommended for any flu-like illness is important, such as avoiding contact with people who are sick, not having direct contact with the animals in the market, and as I said, hand hygiene. So these things are important, and we also work with the health systems around the world so they have enough of capacity to quickly detect, test, and treat people who may have a coronavirus. It is also, just to add, it's really important for people to understand that 99% of confirmed cases of COVID-19 are in China, and that those people who are reported from other countries do not seem to spread the virus into the community, although there is a limited human-to-human transmission.
Yes, Mr. Tarik, but I persist on this because we have media reports that point at a newly published speech of Chinese President Xi Jinping that reveals he was aware of the potential of the severity of the outbreak long before the news actually reached the public. So even as we grapple with the figures from China, which have been conflicting to say the least, one day there is a surge after a new system of counting, then China cites an instance of double counting on another day. We don't know what we are dealing with here. So how much can we actually trust the news, at least on the numbers coming out of China, and what are the numbers that WHO is working with right now?
Well, we are working with the numbers that are provided by Chinese national authorities. You have to understand that with numbers going in the tens of thousands of confirmed cases, it is not that easy to provide accurate information on each case. And China is doing its best to try really to protect its citizens, and by doing that to protect the world. And our Director General was clear on several occasions, this is the time really to stand in solidarity with China and to appreciate everything that they are doing to keep the rest of us safe by introducing very difficult measures in an epicenter of this outbreak, so people from Wuhan cannot travel, and this keeps the rest of the world safer. And we have to recognize that. Obviously, as we understand more virus, and case definition is always changing for any new disease, and Chinese authorities are trying to get clinically diagnosed cases also being counted, so these people can access clinical care as early as possible.
You know, but also, sir, there were reports about a patient getting cured of the virus with the use of antiretroviral drugs, drugs that are used in the treatment of HIV. How true is that, is what I wanted to ask you. And if it is true, then why is it not being used across the world in the absence of a drug that directly deals with COVID-19?
Well, we had last week a very big meeting here in Geneva with 400 leading scientists around the world to look into research and development, not only for treatments, but also for vaccines, for clinical picture of the virus, to look into the source of virus. So they basically looked into what everything needs to be done in coming weeks and months on a research and scientific level. So we not only understand the virus better, but we propose some solutions. Currently, there is no known cure for COVID-19. There are some proposals, there are some treatments that are being looked at, but they have to go through a trial. And at WHO, we are trying to propose a master protocol for a trial of any existing or new treatments, but obviously that it will take some time.
So, Mr. Tarik, can you tell us how close we are to finding a vaccine that can cure COVID-19 with all these trials that are underway?
Well, it will take some time, and in a best scenario, as Dr. Tedros has said, we are looking into 18 months, because first you have to define the compound, basically, to develop the vaccine. Then you have to go in a trial, which is something that you have to do for any product, and then you have to look into mass production. So it's not something that will happen tomorrow, and this is why we are insisting that prevention and strengthening health system is a key right now.
Prevention is key, but it's spreading very fast. And meanwhile, sir, we have several situations that are erupting thanks to the virus. There is the cruise ship off Japan, for one. In Hong Kong, people are so worried about shortages that it's leading to ransacking of provisions in several stores. There are quarantine measures that are being adopted all across the world. I'm just wondering if you're in agreement, at least in the way that governments around the world are dealing with this pandemic. In fact, what are you suggesting to these governments to contain the spread?
Well, we are constantly looking into new evidence, and obviously we would change our recommendations as soon as new evidence emerges. For the time being, we do work with governments around the world. We are trying to understand the measures they are taking. It's normal that countries are taking measures because they want to protect their citizens, and sometimes these measures can be different from one country to another based on their experience, based on their context, based on their analysis. We are trying to understand those measures, trying to align them as much as possible with recommendations done by WHO, and we are in contact with governments to see on a particular situation what could be done, what should be done. But in general, we really believe that on one hand, containment measures are necessary, and this is what China is really doing in affected provinces. But we don't want to go beyond the necessary to affect international trade and travel beyond what is really needed, because we know that the best way to fight the outbreak of any disease is to go to the epicenter.
Mr. Tarik, you did mention that you're reaching out to governments, that you are in conversation with them. Now, when it comes to India specifically, what have you heard so far about the infection cases and the efforts of the government to contain the spread?
Well, we work with every country around the world, and our regional office for Southeast Asia is in Delhi, and I'm sure that contacts are ongoing, because what the Director General has said is that we need to help countries be ready, and many countries in the world do not have a perfect health systems, and the level of preparedness is very different from one country to another, and we need to, with each country individually, identify gaps and try to see what is needed, whether it's supplies of protective equipment, whether it's a training, whether it's making sure that there is a logistical capacity. So this is something that is done, and this is the core mandate of WHO, to make sure that every country in the world has a minimum of capacities to detect and respond should infected person come on their territory.
Well, you've mentioned your engagements with China about this as well. I did mention that it has come under a shadow of doubt with the kind of numbers they are putting out, and there are reports about Xi Jinping, about he knowing about the severity of this crisis much before it came into the public domain. So before we let you go, this is a question about the charges that are being leveled against the Director General of the World Health Organization. Now, he has been accused of conspiring with China in what is being called propaganda to hush up cases of coronavirus. Many have gone on to call the Director General of the World Health Organization China's lapdog, and even worse things. So how do you respond to such charges? How much does it actually get in the way of the work that you need to do now to help control the spread of the coronavirus?
Well, I think really we should really appreciate what China is doing for all of us right now, and we should appreciate the heroic work of Chinese health workers on the front line who are risking their lives to save patients, and at the same time to make sure that that virus does not cross border to other countries, including India. There will be time to look into lessons learned, and none of the response to any outbreak is 100% perfect. But I think it's time really to solidarity right now to help Chinese go through this difficult period, because, as I said, they have 99% of cases, and it's Chinese people who are dying from this disease, instead of pointing fingers and stigmatizing one nation.
Mr. Tarik, thank you very much for joining us on this leg of India development debate. We need to know much more about this virus, and as we grapple with the situation and as it emerges, we will keep touching base with you to find out what really is going on and how the world community can come together and find a way to stem the spread, as it were.